Welcome back. Some good news for the Western Cape health officials as they battle to cope with COVID-19 hospitalisations. A new facility will not only soon come online to assist with the caseload, but humanitarian organisation Gift of the Givers is also lending a hand, supporting the new Mitchell's Plain Field Hospital in Lenteguer. In August, the organisation opened the Freesia ward, which is part of the Mitchell's Plain District Hospital. Dr. Imtiaaz Suleiman is a founder of Gift of the Givers. He's just returned from Cape Town. So tell us about that trip, Dr. Suleiman.
Hi, good evening, Sabir. So yes, it was an excellent trip. It was needed to go and check firsthand what was going on and to see the arrangements being made. And also importantly, it was to support healthcare workers, to tell them they're not alone, things are being done for them, because they've been so demoralized, so, down, no smile. They've just lost the light in their eyes, and they say we're exhausted, we need help, we need staff, we need staff, we need staff. So first stop was our ward, in the Freesia ward, which we converted in July at a cost of 10 million to a COVID-19 dedicated ward. The moment we walked in, they said, look, we need a blood gas machine. And the next morning it was there. We arranged for it to be there. Then I said, what else do you need? They said, we need oxygen points to take in more patients on oxygen. And I said, FX is coming in on Monday. And then from there, I must compliment the Western Cape government. They've done a fantastic job of taking 4 of the wards or the wings inside the Mitchell's Plain complex and converting them into a 200-bed facility. And this is a great thing, because it's not a field hospital, it's an existing building which can later on be used for something else. But they said, look, can you help us here? I said, fine, what do you need? They said, assistance towards oxygen points. So we said we will pay for that also, towards some of the oxygen points. And then we arranged 8 high-flow oxygen machines, which nobody's got in the country right now. There's no stocks. We managed to get 8. They'll be coming soon. And then through CSIR, we managed to arrange 252 ventilators, which are being tested at the moment.
Dr. Suleiman, who is helping you in this regard? Because, obviously resources are very limited, and I know you watch some of your missions, being with you on some of them, you do generally get some support from outside. Are there any people, donors from outside who are helping you? Or are you able to at least arouse some sort of, good givers to be part of your gift givers?
So it's the South African public. It's from all levels of people, from school children to pensioners to working class people to professionals to the corporates to ordinary people. We've got a 28-year track record. So in essence, we don't really look for money. But depending on the amount of money, we can do that amount of spending. If more comes, we can spend more. So it's been a phenomenal support during COVID-19. We've managed to do lots of things in terms of medicine, in terms of drought, boreholes, food parcels, feeding centers, fodder, gender-based violence, care packs for the hospital for nurses and doctors and for the clinics. We've done a lot, and it's all thank you to South Africans and to corporates. And of course, to some extent, we've got some international support that came in from Europe and America.
And I'm wondering, when you say international support from Europe and America, are any of those leftovers from what the Northern Hemisphere countries are accused of doing, hoarding some of the COVID-19 essentials when the undeveloped countries couldn't get it because they didn't have the buying power?
No. These people they're not involved in it. They're just ordinary companies. They got subsidiaries in South Africa. For example, it's Ford Foundation, Walmart, Microsoft. They got companies in South Africa, Anglo-American from the office based in the UK. They all have interest in South Africa. To the extent they could do financial support, they gave financial support. They came back a second time and they came back a third time, and they have interest in helping in South Africans. They don't have ventilators. They don't have other types of equipment, because that has been since the beginning has been a shortage worldwide, because everybody wanted the same thing at the same time, and unfortunately everybody couldn't get everything at the same time. And it's been great that CSIR and the National Ventilator Group designed a South African ventilator, which is more mechanical rather than electronic. It's been tested right now in Tygerberg and a few other hospitals. It seems to be working well. We can roll out something that South African made that will save lives.
I'd imagine that the need will continue to grow as we tackle this second wave and the exponential increase of cases, which has been at an alarming rate. What kind of things are needed, Dr. Suleiman, and what can people do to help?
Well, the first one, the biggest need right now is staff. because typically you can have the best hospitals, all oxygen in the world, big oxygen FROX tents, top-class machines. But if you don't have the personnel to see the patients coming in, what are you going to do? And the personnel are exhausted. Many have passed on. Many have been quarantined. Many have got ill for the second time. So we are at the moment looking around for, registered nurses and paramedics, because you don't need only doctors to monitor that situation. So you need paramedics and registered nurses. We do in some situations need doctors. So anybody who's retired, who's available, who's free now during Christmas break, if they can make themselves available in the centers, Eastern Cape, KZN, Gauteng, and Western Cape, it'll all be appreciated. Of course, except if you've got comorbidities, then it'll be a risk for you to come and help us, and you yourself could be a target to get ill.
Which is what I was going to ask, that people who are retired would typically be of a certain age. Would they not then be putting themselves at risk? But I'd imagine that there's also a way of working out who's vulnerable and which areas that they can work in that will still be valuable but not expose them to much harm.
Exactly. You can triage and you can put the right people in the right place. And yet it's like a lucky packet. Because now in the second phase, this thing is attacking young people who have no comorbidities, who are well, who have exercised, who have trained, and it's taking them out. So it's a risk, but I mean, it's equal risk to everybody. But you do it carefully. The guys are obese, who have hypertension, who have diabetes, who have other disease. You put them in the back, not in the front line. And the more healthy ones, you put them in the front, although it can affect anybody. But that's a risk we all take being in the medical field.
Well, thank you so much. Dr. Imtiaaz Suleiman is founder of Gift of the Givers. And by the way, they're very much present in social media and other areas. If you feel that you would like to be one of those that volunteers or offers you services to help them in the areas where there is a great need, in fact, of hospital medical staffing, as he says, these frontline workers have been going at it since the beginning of COVID-19 in March, where we went under lockdown. So you can imagine just how exhausted they are emotionally and psychologically. So there is certainly a need. So you do your bit where you can.